Bismillahirrahmanirrahim. Dear viewers, this is Dr. Ghufran Babar. I am a pediatric endocrinologist in Kansas City, Missouri. I often get asked about this question by young physicians, how to prepare for USMLE. So I've decided to make this video for their understanding and guidance. So our topic would be how to prepare for USMLE, the tips and tricks for the exam, and how to score a score of 100th percentile or 272. Please subscribe to this channel if you want to stay updated with my upcoming videos about Step 2, clinical knowledge, Step 2, clinical skills, and then Step 3. So going towards the Step 1, which is the first exam to come to US. Before you take the exam, it's very important that you should have a clear understanding of what you really want to do. Coming to US is the American dream. You can come here and get trained in the best facilities. The knowledge that you will gain will be profound. And there are excellent research facilities, you get good salary, and once you get trained, you have the option of staying here or going back. So before you embark on taking the Step 1, you have to decide whether you want to take this adventure of preparing for USMLE exam, because it is a little expensive expedition. And there is cost involved, which starts with registration with the ECFMG, which could be up to $150. Step 1 fee could be up to $940. And if once you register for the exam, you are eligible to take the exam within 3 months. If you want to extend that limit, you have to again pay another $80. So you have to be really careful when you schedule the exam. If you're prepared, go for it. Step 2, again, clinical knowledge part is $940, and same $80 to change the eligibility period from 3 months to more. And if this eligibility period goes by for 3 months and you don't do anything, you may have to pay up to $500. So be quick in making up your exam for the test, and once you make up that exam, go for it. Step 2, clinical skills takes place in US. It can cost up to $1,580, and if you want to change the region, another $75. And if you want to get the certification verification service for your documents, it can take up to $50. And Step 3 is up to $895, and these fees are subject to change. So how do you prepare for the exam is the question which comes into mind, and what are the subjects which are involved in preparing for Step 1. So Step 1 depends on what are your intentions. You can take Step 1 either at the end of the third year, or you can take once you graduate, depending upon whatever your choice is. You're preparing for FCPS, and you can take Step 1 with it, or you prepare for Step 1 and you can take FCPS Part 1 with it, because almost the same knowledge applies. So as far as the subjects go for Step 1, they include the anatomy, which is in the first year, first 2 years of medical school. The books which are recommended are Board Review Series, Gross and Neuroanatomy by Nancy Halliday. There's also High Yield Anatomy, High Yield Embryology, and High Yield Neuroanatomy. And there are other books for cell biology and molecular biology. For physiology, Board Review Series again is by Linda Costanzo, and she has written another excellent book on just plain physiology other than Board Review Series, so you can read that as well. And these books are for the foundation of the knowledge for your step 1. Biochemistry, you can read Lippincott's illustrated book by Denise Ferrer. That is the book you follow. Pathology, again, there is board review series for that, and Pathoma videos can be used. High yield microbiology flashcards available, which you can select randomly, review, and micro sketches are available, which are kind of figures that can help you memorize. And a board review series for microbiology and immunology is also available, which should be studied. So going ahead with the subjects for the USMLE, the next is the pharmacology, and for that too we have board review series by David Luce. Other than that, pharmacology card or pharma cards are available, which are flashcards, and you can revise and study. And there are flashcards by Suzanne Darren, which are also available. For behavioral science, again, board review series. Barbara Fadden is the author for that, and you can read behavioral science. Molecular and cell biology, again, board review series by Leslie Gartner. And there is high yield cell and microbiology book available. Biostatistics is also part of the exam, and there is high yield biostatistics / epidemiology and public health. Other than that, a very important part is first aid Q&A for USMLE Step 1, and there's first aid cases, USMLE Step 1 recall, and there are buzzwords of the board exams by Brent Reinheimer. As far as the review books are concerned, there is another very good source is the Kaplan course, which has got lecture notes for Step 1, and it has got a book of 7 books that you can study, and those are really, really good, and I studied that other than my BRS series. And Kaplan also has Step 1 Integrated Vignettes, another book, and Medical Mnemonics by Kaplan, and it also has some pathology and micro flashcards. Other than that, the review questions play a very important part in your preparation. And the review questions include a Q bank, which is available that you can get. Kaplan MCQs I mentioned. UWorld is a very good resource, and some are available online that you can register online and do those questions. And they really, really help in terms of preparation. The more questions you will do, the better would be your outcome. And if you can do up to 14,000 questions, I can reassure you that your scores would be close to 100 percentile or 272. So the questions are the mainstay for the preparation of USMLE. So you have to do 2 steps. One is the foundation, for which you have to study those books that I mentioned, and second is the MCQs or questions that you have to do. So it depends on how long do you want to take to prepare for the exam. It could be 4 to 6 months. If you are taking exam, say at the end of your 3rd year, then you have read all the basic sciences, so you already have the foundation. Then probably 3 months of MCQs would be useful. If you are after your final year, your house job, then you may have to give yourself 4 to 6 months to prepare, first to revise and build up your foundation again, and then to do the questions. The exam itself has different parts. It has got questions which are in the 7 blocks, and each block is about 60 minutes, and there are 40 questions in each block, so almost 280 questions. And passing score is 192, and the range is around 225 to 330 for the test score. And depending upon where your score is, you would be a higher a candidate with higher chance of getting the residency later on. If you fail the exam, you can retake in 3 months. However, if you take a low score and you want to retake, you cannot retake for 7 months. So that is very, very, very important, that when you prepare for the exam, you want to make sure that you have really prepared well for the exam, so that you don't end up with a low score, which will not be useful for you. So how are you gonna do it? So like I said, it can take up to 3 months to have a base, or some people who are good, they're fast learners, 2 months of base and then 2 months of MCQs. And those questions are really, really, really useful. So how are you gonna do? Either you can study in blocks of 4 hours and then take 1 hour break in a day, and you can do 4-hour blocks, say in the morning from 8, 9, 10, 11, 12, and take a break for lunch, and then do another block after that at 1 o'clock, 2, 3, 4, 5, and then take another break, and then restart at 6, 7, 8, 9, 10. And at 10 you can finish, relax, and have a good night sleep. Or you can do 2 4-hour blocks, and then the next 4-hour blocks you can do the questions. And those questions could be from the system. Say you are studying cardiology or physiology of heart, from the physiology, then you can do the MCQs on that. So that will give you a good idea of what would be the questions, how to answer those, and how to interpret the question, because answering question is a big art. So doing the questions from the get-go really would improve your score versus not doing those questions on a daily basis. So I think that would be a good idea to do 2 blocks of 4 hours each of different subjects. You can do 1 subject and finish 1 and then start the other one, or you can do 2 or 3 subjects at the same time, and then in the 3rd block you can do the questions and practice more and more. So when you do a block of 40 questions, then you need to read the explanation, because the explanation has, say, if there is a patient which presents with chest pain and there are different causes of chest pain listed, they will explain the chest pain of the heart origin. If there's pneumonia pain, costochondritis, pericarditis, or pleuritis, all of them can cause chest pains. So you have to figure out from the question that which is this chest pain and what type of disorder this child or this patient has. So when you review those MCQs, you know, I did my MCQs and my preparation with one of my good friends. So you need to have a buddy that you can study with, and I was lucky that my buddy was Dr. Ghufran Babar. He's a pediatrician in Pakistan. So we used to study in blocks and would review things together, discuss with each other. And in the MCQs, you need to find out, ask yourself that what could I be tested about this question? And then try to underline and make your own notes for that specific question. So if you make notes for those 40 questions per day, that would be amazing. And before exam in last week, you can just review those high yield points that you have prepared over the period of 4 months. That would be really, really good for your solid base for your knowledge. So that is a typical, once you have finished your books, say in 2 to 3 months, the board review series and high yield books, then you can use the first aid and these Q banks and the multiple choice questions from different sources, from Kaplan, from UWorld, and other resources that you can find locally. then you can practice, and you can Google. There are online tests available that you can buy, and those questions could be from USMLE, World, UWorld, so MBOSS. So there are a lot of resources that you can use. And the most important thing is that you keep on tracking your progress, that how am I doing. So I did 10% of questions right this time, then 20, and this percentage will improve. Sometimes it may go down, may go up. And the most important thing is, if you are not getting the question or answers right, please don't get disappointed, because ultimately your score will get better as long as you are working hard on a consistent basis, and the consistency is the key. So out of 6 days, the 7th day of the week, don't schedule anything on your schedule, and the 7th day you can use to catch up on things. Say on a given day you were not able to follow your schedule, there were things which were left over you had to do. You can relax a few hours, you can go meet your family, go out and eat somewhere, so that you don't get saturated. And some people, even during their preparation, they may follow or they may shadow someone to keep fresh, to stay in touch with the patients, because that really helps in their preparation, and they don't suffer from boredom and they don't burn out. So that application is important. And then people who, at some point you will reach a plateau and your score, but don't worry, keep on doing the questions. You need to maintain that plateau in your preparation, so that your scores, don't fall down. As far as hard work is the key. You have to work hard. There's no way around it, because at the other side of the tunnel, you will have the reward. And I know that people back home, they really work hard, they study well, so they can really achieve things. As far as some of the tips are, again, focusing on the questions. That would be key. If you can do 14,000 questions, I guarantee that your score would be close to 100th percentile, inshallah. So 60% you can study UWorld, you can review the videos, and in the last 2 to 3 weeks, really focus on the questions and review the flashcards. And review the high yield points. That's a tip number 2. The high yield points really bring you good scores. So other than the high yield books, make sure every question, every MCQ that you do during that 1-page explanation of the answer, make your own high yield points. Ask yourself, what could I be tested on? Or what is the real pearl in this explanation that I could learn? Because we couldn't go through the text, but sometimes important points may get overlooked. So you ask yourself, what is the pearl? What is the thing that I've learned here? Write it down so that you can review those points close to exam. Flashcards revision for microbiology and pharmacology is very important, because they give you good points. If you know them, you will score well, and they are easy to answer. They may give you a long vignette, and at the end of the question they may ask, what is the side effect of valproic acid? So if you know that, you will cash in very quickly. Or if you know that what is the commonest organism for a specific infection, you know the microbiology, you will score well. So those are the points that help you. Tip number 4 is that you have to stay consistent. It is sometimes hard. Just keep on motivating yourself. Think about the fruits that you will attain from working hard. So stay consistent, even if you study less, but don't waste your time, so that you don't have to develop the tempo again. And remember, it is an expensive test, and if you score low, your chances for getting into US and getting a residency will be decreased profoundly. And sometimes, like I said, sometimes it happens, you don't follow the schedule, you can go off of it, but don't worry about it. Next day is a new day and you can restart the preparation again. It's just the self-motivation which is important. And like I said early, your buddy or your friend who is studying with you, you can divide the topics that, okay, I'm gonna study first half of cardiology. You read the second half, although I'm going to read the second half too, but we will discuss with each other. And once you discuss something with a friend and you've written your high yield points, trust me, you will never forget them. Then you look at the answers that you have done. So in the beginning, you may want to do first month or two the questions of the system that you have studied, physiology, anatomy, biochemistry, whatever you are doing. And then after you have base knowledge, then you can use multiple systems together. So you can do a mix of questions which will be like exam. And you have to make sure that you read those questions and then go back to your reviews books that, okay, I read this thing, but I've made this error in the question. So what was the mistake that I did not learn during my concept making study? And you can review that and clarify your concepts. And make sure that at the end, last few months, you have to make sure that you practice the question. Last couple of months, practice the question. If you learn anything from this video, is to practice the questions up to 14,000. The more questions you do, our system is most countries outside US is more kind of knowledge gaining and then reproduction of that knowledge, while the USMLE is based on the understanding of knowledge and the interpretation of the vignette and coming up with the best answer. So I will make a video on how to answer the MCQs on a later day, but at this time you have to remember that you have to continue to practice the test. On the test day, like I said, there will be 7 blocks, 40 questions each, and you will have 1 hour approximate break, and you can divide your break into different times. Like you want to start with 5-minute breaks, and for lunch you can leave 20 minutes break, and for the last 2 blocks again you can have 10 minutes break again, because in the beginning of the exam you are fresh, you want less break, then lunch you can relax, 20 minutes break, and then afterwards you can give 10-minute breaks so that you are getting tired, so you can focus better after having a break. So I hope that this video will be useful. I will make videos for step 2, clinical knowledge and clinical skill assessment exams, as well as step 3. So please stay tuned, like this video, and be generous in sharing and subscribing to my channel. May Allah help you with the preparation for the exam, and I wish you best of luck. Again, this is Dr. Babar, and may Allah bless all of us. Thank you.